So what we will cover, we'll go over a brief reminder of the COVID-19 illness and the SARS-CoV-2 virus, very brief because you all know a lot about it now. We'll talk about vaccines in general and then especially the COVID-19 vaccines in GCC. So, as I said, we'll keep this one very short. This is a virus, SARS-CoV-2 is the name. It can cause an illness called COVID-19. You can get it from an infected person or an infected surface. However, lately the studies show that the infected surface is actually not that important. So most of the people get it from another infected person. You can get it through droplets that leave a person's nose or mouth at the time that they're talking, sneezing, laughing. When these droplets land in your face or your nose or your mouth, then they can infect you. You can also get it through airborne transmission. That means the droplets are really, really small. That means they can travel much further in the air. So you don't even need to be close to a person. You can be further away, but still get it. Now, again, this is not the most important route of transmission. Preventive measures, as we all are doing for months now, hygiene, so wash your hands, sanitize your hands regularly, social distance, and then PPEs, so masks, gloves in certain conditions, and the one we're going to talk about today, the vaccines. Symptoms can vary a lot. Fever, cough, feeling tired, no energy, strong headaches, very specific, no smell or no taste, shortness of breath, and it can go into very severe symptoms. You can also have diarrhea, etc. Very diverse. Now, globally, where are we? As of yesterday, 10 a.m., when you check the Johns Hopkins Corona map, which is a very good map to follow the situation, then we were at more than 106 million cases, of which 2.3 fatalities. If we look at UAE, I'm sorry I didn't put all the countries in there, but if we look at UAE, yesterday morning we were at more than 300,000 cases, of which 930 fatalities. Now this is a serious situation because unfortunately this morning we had a new high in fatalities. We had 19 fatalities reported. So since the winter break, the number of cases are going up, but also the number of fatalities, which makes this topic about vaccination even more important. In general, why do we use vaccines? Well, we use vaccines to prevent illness that can be caused by a bacteria or by a virus. When we are able to vaccinate a lot of people in our community, we hope to achieve herd immunity. This means that so many people in our community are vaccinated that it actually slows and hopefully stops the spread of this pathogen in the community. What does that do? Well, there are always people that cannot be vaccinated. Specifically for this vaccine, for example, for COVID-19, we don't want to vaccinate the children yet or pregnant women because there is no scientific data yet on the safety of this vaccine in pregnancy and for children. By vaccinating a lot of the other people, we can protect those vulnerable people. We can protect the people that don't have an opportunity to get the vaccine. Now, another advantage of vaccinations is that, yes, vaccines can give side effects, but these will always be less than actually getting the disease. So it is better to be vaccinated and choosing to be vaccinated over the natural risk of infection. How do vaccines work? There are different technologies out there, and I will discuss the ones that are relevant for this region because of the vaccines we have in this region. But in general, a vaccine helps your body to develop immunity. It trains your mechanism to develop a protection against a new encounter with that particular pathogen, that particular virus or bacteria. Up until now, the vaccines that were developed were targeting a particular illness. In future, that might change. They might target more illnesses. For the moment, it's usually just that one particular. Now, a little bit more in depth, this is a slide on your immunity. Now, if a pathogen, for example, we inject you with a vaccine, then that vaccine will work as a pathogen. If that enters your body, your white blood cells will rush to your defense. You will have different types of white blood cells. You've got a particular type of white blood cell, the innate cells, that will start to try and destroy the pathogen themselves. By doing so, they also trigger your lymphocytes. That's another group of white blood cells. They will come in and they will try and make antibodies that really target the pathogen. And that's a very, very specific antibody, one antibody for one pathogen. If you have other antibodies for other illnesses, they might not work for that particular pathogen. And then they will also create memory cells that will circulate in your blood after you have the infection or after you've been vaccinated. If you encounter the pathogen in future, these memory cells will be able to very quickly start off your immune response and your defense. Just to show you, there are a high number of COVID vaccines being developed. And they don't only use one technology, they will use many different technologies. So as you can see, there are a lot of them. I think by now there are perhaps even close to 200 in development. They don't all succeed. So some of them have already been stopped. Why do you need more than one dose? For most vaccines that are available already, your doctor will tell you, okay, you need one, you need a second one, you might need a third one, or you might need boosters in future. For the COVID-19 vaccines, most of them will need two. That is because once you have your first dose, your first exposure to this vaccine and the pathogen, you will build up a slow immune response. It will take some time before your body will be able to create your defense. And that might still be quite weak. And it might start to lower even. At that time, when we give you a second vaccine, you will react faster with a better and stronger immune response, which is obviously better for you in the end. Then at that time, also your memory response will be created. What I mentioned before, that these cells stay in your body so that if in future you are exposed to the same pathogen, you will react really quickly. This is a bit of a complicated slide, so I will not elaborate too much on it. I just want to highlight a few important things. So you have a coronavirus. The coronavirus has RNA as its genetic code. And on the surface, it has some spike proteins. These spike proteins are important because that's what the virus uses to enter your cells. And once it enters your cells, it can replicate and it can make you sick. Now, when antibodies will start working, they will target these particular spike proteins. And you will see that later on in the presentation, these spike proteins are exactly what is targeted by your vaccines. So, more specifically about the COVID vaccines that we currently have in GCC. The most important one for most countries out there is the Pfizer BioNTech. Then there are some countries that use Sinopharm, AstraZeneca. Very recently, but only in Saudi, they use Moderna, and Sputnik V is only for emergency use in UAE. So the two last ones I will only very briefly address, and the three first ones I will give more information because they're more used in the GCC region. So these are the three ones that are mostly used for the moment. Sinopharm is a Chinese manufactured vaccine. They have done a lot of phase 3 trials that have shown good results and that are still ongoing. They use an inactivated virus. I will tell you a little bit more about that later on. And they show an efficacy of 86% in the UAE trial, 79% in the Chinese trial. What does that mean? So an efficacy rate means that when we inject 100 people with the same vaccine, we can see that it really works well in 86 of those 100 people. Why not 100? Well, in medicine, almost never we can reach 100% for anything. But WHO, World Health Organization, has set a limit, a cutoff of 50% in order to be accepted as a COVID-19 vaccine. So if you get 80%, you're actually doing really well. Now, how many vaccines do you need? 2 doses, one on day 0, one on day 21, and they will be injected in your deltoid muscle in the upper arm. Then we have the Pfizer vaccine. This is manufactured by Pfizer and created by Pfizer, American company, and BioNTech, German. They've done also a lot of phase 3 trials in different countries and still ongoing. They use a new technology, mRNA, which, don't worry, I will talk about later in the presentation. They have a very good efficacy rate, more than 90%. They have also 2 doses, one on day 0, one on day 21, and also intramuscular in your muscle in the upper arm. Then the third one is AstraZeneca, manufactured or created by Oxford AstraZeneca. The ones we get here in the region are very often manufactured by the Indian Serum Institute. They've conducted phase 3 trials in different countries and still ongoing. And they use viral vector. Again, I will talk about that later. Their efficacy rate seems a little bit lower, but still very much above the 50% cutoff that WHO gives. They have also a schedule of 2 doses, one day 0, one day 28, and they are doing trials where they are looking at different schedules, even with the possibility of giving the second dose up to 12 weeks after the first dose. Again, in your muscle, in the upper arm. So Pfizer is the one that most countries in GCA are using. So I'll start with this one. As I mentioned, it's a new technology. So it is the mRNA technology, where they use a strain of RNA, which is the genetic code, and they use the one specifically for those viral proteins that are on the surface of the virus, which I mentioned earlier. When this vaccine is injected in your body, that viral RNA genetic code can start creating viral proteins. They are then going to trigger your immune response. Your antibodies will come up. A bit slower apparently for the antibody response, but still very good. It's a newer technology. The only downside for a lot of countries and a lot of facilities is that it's very difficult to store. It needs an ultra cold chain, -60 to -80 degrees. It's also a little bit more expensive, which is important for a lot of countries. So who can get this shot? Well, the inclusion criteria, they will depend on your country's guidelines. So countries will set guidelines according to how many vaccines they have, if they want to prioritize certain groups. For example, in Dubai, in general, it's prioritized for the older generation and people with chronic illnesses. And you need to be a Dubai visa residency visa holder, and your visa needs to be valid for more than 6 months. But please do check your own country. I will give you some links later on where you can find information. Who should not get the shot? And this is actually, again, variable between countries. So certain countries first start with certain groups of people. But in general, the information from Pfizer itself is that we shouldn't give the vaccine to people below the age of 18, nor pregnant women, nor women who want to become pregnant in the next 3 months, nor breastfeeding women. There's no information on safety in these categories. Then people whose immune deficiency is low, or who are immune deficient, so their immune system is not working properly. If you then give a vaccine, your body will not be able to make the right response to it. So we might give you a vaccine, but if your body is not creating that immune response, you actually don't benefit from it. So it's better to wait until your immunity is back. People who've had a severe allergic reaction before. And for Pfizer, this is important because they say a severe allergic reaction to any vaccine before, to food, to medicine, or to anything. Or people who carry an EpiPen around. Because Pfizer has given a little bit more of severe allergic reactions, anaphylactic shocks, than the other vaccines that we have. So if you have a history of severe allergic reaction, you might want to opt for another vaccine. Also, if you have any other vaccine in the last month, not the Pfizer one, of course, but if you have any other vaccine in the last month, you should wait. Now, where can you get the shots? Well, so in UAE, only through DHA, Dubai Health Authority. In Bahrain, you need to register online. The link is there, or you can call 444. If you are in Kuwait, then the phase 1 will focus on the frontline workers, on elderly people, and on people with chronic illnesses. And again, you need to pre-register. If you are in Qatar, then you need to make appointments with your primary health centers. But again, they prioritize 3 key groups: the elderly, the people with chronic conditions, and the key healthcare workers. Not all healthcare workers, but particular groups. Then in Oman, same, certain healthcare workers, the people who actually are identified as having a higher risk of encountering the virus. And then people with certain chronic illnesses. And then if you look at Saudi, again, prioritization is happening: elderly, chronic illnesses, people or professionals vulnerable due to the frequent direct contact with COVID-infected people. Again, also you need to pre-register. Now, common side effects, well, like most of the vaccines that you take, if it's for hepatitis or for yellow fever, you can get some pain in the arm where they've injected. Now, people who have the Pfizer vaccine do seem to report a little bit more of the other side effects, a bit more fatigue, headaches, some joint and muscle pain, sometimes fever, vomiting, diarrhea. If you're wondering, should I still get the vaccine? Well, yes, because getting perhaps a 1 or a 2 day mild symptoms, because usually they're short-lived and mild, is still better than getting COVID. Now, if we look at then Sinopharm, Sinopharm is one of the other vaccines that is available in GCC countries. This is an inactivated vaccine. Okay? That means that the vaccine carries the dead SARS-CoV-2 virus. It is dead, so you don't need to worry about that. When that dead virus then comes into your body will start creating antibodies and memory cells as a protection, so that the next time you encounter the virus, you will hopefully not get sick. It is an old, well-known technology. It is used in many other vaccines. For example, one very well-known travel health vaccine is hepatitis A. So it's not new. It's easier to store. It only requires 4 to 6 degrees centigrade storage facilities. And that makes it also easier to deliver to more remote locations in the world. It's also cheaper. So this Chinese group is focusing also a lot on Africa. Who can get the shot? So again, this depends on your country's guidelines. In general, it is intended for the people above age 16. You need to be in good, stable health, and they recommend that your BP should be under control. And you should, if you have any chronic illnesses, they should be well controlled and asymptomatic. Now, exclusion criteria, who should not get the shot. Again, the general information, and it might differ between countries for specific exclusion criteria, but in general, if you've had serious COVID infection before, you need to talk to your doctor first. If you're pregnant, if you are below age 16, if you have any uncontrolled underlying medical conditions, if you've had any of the listed medical conditions, which I will not go into because that will take us too far. But if you've had, for example, Guillain-Barré syndrome, you will know. And if you're taking medication that lowers your immune system, because then again, wait until you stop with that medication or until you reduce that medication so that your vaccine can actually work for you. Also, if you've participated in a trial for this vaccine, you need to wait. Where to get it? For the moment in UAE, you can get it through MOH, Ministry of Health. You can get it through SEHA. You can get it through Dubai Health Authority. And if you're in Bahrain, same as the Pfizer, so online registration, of which you see the link there. Side effects, apparently a little bit less than the Pfizer vaccine, or less reported by the candidates. Same, some injection site pain, headache, muscle ache, feverish, nausea and vomiting. Again, these symptoms are short-lived and mild. So no reason to not take the vaccine because it's still better than getting COVID. And then the third vaccine that was introduced in some countries last week only is the AstraZeneca vaccine. This AstraZeneca vaccine is using a non-replicating viral vector. So it is actually using a particular virus, and it introduces a little bit of that coronavirus spike gene into that virus, and then it administers the virus to you. Now, this virus for AstraZeneca, it is an adenovirus that is making chimpanzees ill, but when it is infected in humans, it's absolutely safe. Okay, so you will not get ill because of it. Once that virus is in your body, that gene that has been inserted in it will start creating your viral spikes, your spike proteins, and then your body will start to develop immunity by making antibodies and memory cells. It's again a very known technology. For example, the Russian vaccine Sputnik, the same center that developed the Russian vaccine has made an Ebola vaccine made with this technique. It's easier to store, 4 to 6 degrees centigrade, and hence easier to use in many countries. Inclusion criteria, who can get the shot? Again, it depends on your country's guidelines. People between 18 and 60. So again, no data for the younger people, but also there is, in the current studies so far, there's limited data on the safety in the older population. So in this region, we are reserving it for people below age 60. So 18 to 60. People with chronic illnesses. Now, if you live in UAE, for the moment, you need to fall into those two categories, otherwise with appointments only. Who should not get the shot? This is the general information from AstraZeneca. Again, you might have other criteria in your own country, so you need to check that. But the information from AstraZeneca, the general population over age 60, they're still working on those studies. People below age 18, pregnant women, breastfeeding women, so the same as the other vaccines. People with immune deficiency disease, so if your immunity is not working, then the vaccine might not work 100%. People with coagulation dysfunction, that means they have problems with bleeding. History of severe allergic reaction to the vaccine, to vaccinations in general, or as actually any vaccine, if you're allergic to any of the components. And then again, if you have had another vaccine in the last month, you should wait. Where to get this vaccine? In UAE, only through Dubai Health Authority. In Bahrain, you need to register. And it is also available in Saudi, again, with a priority to elderly, chronic illnesses, etc. And you need to pre-register. Now, common side effects for this one, the same, some mild pain on your injection site, headache, fatigue, you can read them on the slide. Again, very similar to other vaccines out there that we've been taking for many years. And again, not a reason to say you shouldn't take the vaccine because side effects are short-lived and mild. Now, just very briefly, In UAE, there's also the Sputnik V vaccine. In Abu Dhabi, it has been approved for emergency use. It is created in Russia. They're doing ongoing trials also in UAE. It is using the same technique as the AstraZeneca. However, it's using a slightly different virus. It's using a human adenovirus, not the chimpanzee one. But again, it is a safe virus. Good efficacy rate, 91%. 2 doses, day 0, day 21, and again in your arm. And then in Saudi, they have started with the Moderna vaccine. And this is made in the US with phase 3 trials happening in the US. It's the same technology as the Pfizer vaccine, mRNA, gives a very good efficacy rate, 94.1%. It has 2 doses, day 0, day 28, so that's slightly different to the Pfizer. Plus, you don't need to store it in that ultra cold chain. You can store it at the normal cold temperature. And again, it's in your muscle, injected in the upper arm. So I don't talk a lot about these because they're very limited for the moment. That brings me at the end of my presentation. My advice is think about the choices that you have in your own country. Inform yourself if you can get the vaccine. If you can, then please think about it, because it's better to get the vaccine for yourself, for your community, for the loved ones around you, than to get COVID. So in case you want to research a little bit more, I've added some of my references. Okay, and then I will leave you at the Q&A, which last time we had so many questions. So I am very willing to answer a lot of questions today again. So let me just try and find some questions. Okay. So a question that requires some guidance, and it's a very long one. Now, I tested positive in Jan, finished home quarantine, tested positive again. Oh, but this is not to do about the vaccine. So I think that question will be addressed at a different time. The thing about the vaccine is, if you're a diabetic, if you're well controlled, do get the vaccine. You fall into the chronic illnesses. Do we have an option to choose? Yes, in most countries so far, this vaccine is optional. There, as to my knowledge, there is no country that has made the vaccine mandatory so far. Somebody's asking about thyroid medication and beta blockers. My advice for illnesses is, because I don't know your history, I don't know your latest blood test, I don't know your current medication. If you have any concerns, then please talk to your own doctor, who knows your case much better and who can give you advice on whether or not you should get the vaccine. Then, diabetic patients, yes, do get the vaccine. Do you need to do a PCR test after taking the will the PCR test be positive after taking the Sinopharm vaccine? Well, the vaccine will not make you turn positive on this test. If you do turn positive, it's because of the virus. It means you have COVID-19. Is it okay to take the vaccine if you're taking medicine for hypertension? Yes, provided your blood pressure is under control, and then you fall into the chronic illness category. If your blood pressure is not under control, or if you're not sure your health is stable, talk to your doctor. As per the current date, the vaccine first dose are not available for 50 below. When it will be available? I don't recall saying this, but there is no cutoff for age 50 for the moment. So, but check your own country's guidelines. Will the vaccine turn your COVID test positive? No, I've answered that one. What if vaccine was taken, person started feeling bad, took COVID test and result was positive? Is it normal to be tested positive right after taking the vaccine? Well, no, I think I answered this before, huh? So your body needs time to develop immunity. And then some people don't ever develop a good immunity after the vaccine. So if your test is positive, then it means you need to consider you have the SARS-CoV-2 virus. Now, I got an appointment on the 5th of Feb, but later got message that it's cancelled. What shall I do now? So if you get to get the vaccine ASAP, as I intend to take it before I travel, well, if your appointment for the 5th of Feb was for your second dose, then in most countries, they will accept giving you your second dose. You just need to go to the center and take your proof of your first vaccination, because you should have gotten either an email with a vaccination card or a hard copy, like an actual card when you got your first vaccine. If you made an appointment for your first vaccine on the 5th of Feb, then try to make another another appointment. It depends which country you're in, whether they have sufficient stock or not. Now, there is no requirement for travel and vaccinations for the moment. So it's not because you're not vaccinated, you will not be allowed to travel. What are the chances of the Sinopharm vaccine being activated over time? Since inactivated, is it being proved to activate? What percent? I'm not too sure what this person is trying to ask, but what I think it is the Sinopharm is using a dead virus. Will that virus, once it's in your body, will it become alive again? No, that is dead. Is it possible getting COVID after vaccine? So yes, you do still need to be careful. If you get your first dose, your body will need time to build up your immunity. So you still need to keep on being careful. Even after your second dose, the most of the vaccines still don't reach their full potential within 1 week, or for some vaccines 2 weeks after the second dose. And then if you keep in mind that efficacy rate, it's not 100%. So for the moment, most of the country, well, actually all country guidelines out there are, even if you're vaccinated, adhere to all preventive and precautionary measures. Keep wearing your mask, sanitize, social distance, quarantine, or even isolate if necessary. That means if you've been identified as a positive, as a contact of a positive person, or you have been identified as a positive COVID person. No, that's the same question again. Is there any ways to determine that the vaccine is functioning? Well, you could always try and do an antibody test. So after your vaccines, you could try and verify. Now, the thing is about the antibody tests, it's not available everywhere and your health insurance will not cover it. It's quite expensive. So it's up to you if you want to do this or not. And then doing an antibody test might not even give you all the necessary information. If you don't have antibodies, then most likely this vaccine has not worked properly for you, but then it depends when you do the test. So the general guidelines are you don't really need to test. Okay, one question about somebody who was positive after the first dose and is now asking, should I get the second dose? I was not able to visit the facility on time to get my second dose. Well, I'm sorry to hear that. I hope you only had a mild illness. So for a lot of countries, it depends a little bit. If you had a mild illness, if you've done your isolation and after your 10 days, or depending on the country, it might still be 14 days of isolation, you feel fine, you're recovered, you have had no fever in the last 3 days without taking medication, then go get your second vaccine as soon as possible. If you've had a moderate illness or a severe illness, if you were in hospital, if you were on a ventilator, if you were on oxygen, Then you need to really make sure you're well recovered. And then you need to check your country's guidelines. For example, in UAE, there's an MOH, Ministry of Health protocol we need to follow, where you need to be tested to see you're well recovered, but also we need to do antibody tests. So if that's the case of a moderate or severe illness, then contact your doctor before going for your vaccine. But in general, having COVID illness after your first vaccine doesn't mean you shouldn't take your second dose. Somebody's asking me if I got the vaccine. Of course. Of course, as soon as I could. Any precautions related to fatty liver? That depends a little bit on what's going on. If you have a grade 1 fatty liver and your health is stable, then you can get the vaccine. However, there are different and more severe cases of or categories of fatty liver. So in those cases, you need to contact your doctor, see that your health is stable for the moment. Then there is just a word, papillary carcinoma. I'm not sure what that refers to for this person, but in general, if you are currently dealing with a cancer, then you are probably not a good candidate for the vaccine. Talk to your doctor. If this cancer was in the past and you are in remission, then most likely you will be a candidate if you don't have any other underlying medical conditions. Regarding the advice for couples planning a family, is the advice applicable for both male and female? Discrimination again, huh? So if you are planning a family, if you're planning a family in the far future, you don't need to worry, nor the male nor the female partner. But if you're now trying to get pregnant, then the woman should wait with the vaccine. We don't have any data to suggest that taking this vaccine while you might be pregnant is safe for you. For the men, doesn't really matter. There is no data on infertility or to support that this vaccine might cause infertility. So that's where the discrimination comes in. But do be careful if you're now trying to get pregnant. For the woman, you need to postpone your vaccines. Are we eligible to take vaccine if we had COVID infection within the last 3 to 4 weeks? So as I mentioned earlier, it depends on what type of infection you had. Now, in general, in the international guidelines, it mentions if you've not had any vaccine for COVID and you've had the COVID illness, then they advise you to wait for 3 months. Why is that? Not because this is going to harm you, but this is because it is going to, because they want to save the vaccines for people without immunity. If you had a COVID-19 infection, most likely your body will have built up some natural immunity. And that will most likely protect you for 3 months at least. So they say use that first, then get the vaccine. If you live in UAE, however, UAE has said if it's a mild illness, you don't need to wait for 3 months. You can get it. Now, I'm just seeing on my second screen that there is another question. Hi, Dr. Sarah. You mentioned earlier that if you get vaccinated, you will not pose risk to pregnant women and kids. However, data reports suggest that you're not prone to contracting the virus and that you can still contract the virus even after you're vaccinated, which means you can be a carrier and can infect other people, those who are not vaccinated. Please advise if this is true. Yes, well, we're in a bit of a difficult situation for the moment. What scientists try to achieve with vaccinating people is that when you are vaccinated and you encounter this virus for the second time, not only will you not get sick, but you will also not be able to transmit the virus to somebody else. That is the ideal scenario. So you cannot get sick and you are not infectious to the people around you. This is what they're trying to achieve with the COVID-19 vaccine. But for the moment, there is no data yet. They are still researching this. There is a very preliminary study from AstraZeneca that shows that your infectiousness will be cut with 50%. which is also quite good. But this is only preliminary data. More studies need to be done to show that this virus will be less infectious or not infectious at all in people who have had the vaccine. One more here. Considering a relatively low mortality rate, how safe are the vaccines comparing to having COVID-19 virus and recovering from that? Yes, that's a very valid question. You indeed look at the numbers and think, oh, I will not die if I have COVID-19. The issue is we cannot predict who will die and who will not die. And yes, the elderly population, people with chronic illnesses, are more vulnerable to severe illness and to passing away. However, there are so many cases of young people who pass away because of the illness. On top of that, if you hear that every day in UAE, 5, 6, 9, 12, 17 people pass away, you don't want to be one of them. If we look at the data from the trials and from the vaccines, millions of people worldwide have been vaccinated. How many people have passed away because of the vaccine? If I look at UAE, more than 4.5 million people have been, or more than 4.5 vaccines have been given, no fatality yet. So in my opinion, choose wisely. You know what I would choose? I would choose the vaccine. Let's scroll down for some more. If I experience side effects after being vaccinated, like fever, can I take medicine for fever? Of course. So in general, we recommend that if you're not feeling well after your vaccine, if you have side effects, yes, you can take some medication to reduce the fever. Fever is not very favorable. Now, you do need to be careful. If you do have any other side effects that seem to indicate you might have COVID instead of side effects, do get tested and isolate yourself. If you get a very, very strong headache, if you lose your sense of smell or taste, if the fever lasts for more than a day or two. Do we need to get an appointment for the vaccine? Please check in your own country. It will depend from country to country. If you get tested positive before, will inactive vaccine give you any benefit, or is Pfizer the best option? Well, it depends on what is available in your country. Okay, it doesn't matter if you've had the illness before and you will be covered. If you had a mild illness, then any vaccine is okay. Is there any restriction for smoking or consuming alcohol after vaccination? Well, I'm a doctor, so if you're asking me if it's okay to smoke, I cannot say yes. I have to tell you, think about how deadly smoking is and consider quitting. Same for alcohol. I cannot say go and drink alcohol, only in moderation. If I leave that aside, that aspect, I've given you my professional advice now. There is no contraindication for smokers to get the vaccine. There is no contraindication to drink a glass of alcohol in the evening, except if you perhaps have side effects, you might want to judge that case by case. Is it recommended to make antibody tests after the first and second dose? So no, it's not recommended. I went into that a little deeper earlier. Then let's scroll down to some more questions. Can we quickly review the vaccines that doesn't include DNA, RNA? Thanks. Please refer back to my presentation. I think I've given a lot of information on the other vaccines. And I'm not going to repeat the session here. Can I take other vaccines like Hep A after COVID vaccination? Well, it depends on the type of vaccine you want. So if you need any other vaccines, but you are doing your COVID schedule, stick to your COVID schedule for the moment, finish that one. Then it depends on the type of vaccine you need afterwards. But because COVID is a different technology or it is an inactivated vaccine, it is not. The ones we have in the region here are not live attenuated vaccines. You should be able to get Hep A afterwards. Do we need to get appointments? Again, check with your country. In UAE, yes. One more question here. Is anyone, if anyone has been vaccinated with one vaccine, can he take another one within 6 months, or should there be a specific time? So there is no recommendation that we need one in 6 months just yet. If you start with your schedule, then if you start with product A, please get your second one with product A as well. Studies are ongoing to check if we can mix, but there's no answer yet. So for the moment, the recommendation is stick to the same product for your basic schedule of the first and the second dose. There is no recommendation that we need a booster in 6 months, in 1 year, in 12 years. We simply don't know yet because we don't have that long-term data yet. But what does seem to be possible is if there is a need for a booster in, for example, 12 months, you most likely will be able to vaccinate with another product, another vaccine at that time. And then it will also depend on what vaccine is available in your country at that time. Which specific specialist can exactly guide on the effects of the vaccine if I have to visit a doctor? Will travel be a concern? I don't understand this question. So if you have an underlying medical condition, then it depends on which specialist you're seeing already. Then please contact that specialist. If you have a heart condition and you're seeing a cardiologist or your own family doctor, then ask them if you have any concerns, if you can take the vaccine, if your condition is stable, yes or no. Will travel be a concern? Again, I don't understand this question. If you've had the vaccines, if you have no side effects, you feel fine otherwise, then do travel. What is the validity of Sinopharm vaccine? How long does it work once you take both doses? Again, there is no long-term data, so I cannot give you any feedback on that. We don't know. In UAE, for example, the studies only started in July. This is only a little more than half a year. We don't know how long they will keep working, but don't worry. The manufacturers are absolutely looking into this. They are continuing the studies. What precautions can be taken for children less than 2 years of age? They cannot get vaccinated, okay? So please don't try. There's no data on safety for the moment. Is there any risk for BP or diabetes patients to take the vaccine? Again, if you have a high blood pressure or diabetes, you fall into the chronic illness category. If your illness is under control and your health status is stable, please get the vaccine because you are in the vulnerable population for COVID-19. If you are not sure whether or not your health status is stable, if your blood pressure is not under control, if your sugar is not under control, talk to your doctor first. What do you think the best vaccine to get when you are over 60 and diabetic? So if you're over 60, the recommendations for the moment is don't take the AstraZeneca, choose another one that's available. And if you're diabetic and over 60, you fall in most countries' priority list, so you can get any of the vaccines available. How long is the wait for people who have immunodeficiencies or have allergies? Well, allergies, please talk to your doctor. You might not need to wait. Immunodeficiencies, well, your doctor will guide you on that. If it is because you're taking a particular medication, it might depend on the dose of your medication. And if you are slowly tapering it down, your doctor will tell you when it's good for you to start the medication. If you're suffering from a disease that is lowering your immune system, again, talk to your doctor. He or she will advise you on when is a good time for you to take the vaccine. The concern here is that if you take the vaccine, it might not work for you. And that is not good. We want the vaccine to work for you. Is it possible to swap between the two doses between vaccine types? No. So if you start with one type of vaccine, do your second dose with the same type of vaccine. We don't have any data to suggest that you can swap for the moment. How long the validity of COVID vaccines? Again, I've answered that question. Can we be considered for Pfizer vaccine if suffering with an IBD? Okay, it is a chronic disease, but not sure whether it'll be considered. Now, IBD can stand for irritable bowel disease or for inflammatory bowel disease. So you need to know which of the two you have. If you have a Crohn's illness, for example, you are considered with a chronic disease. So in that case, yes, you can benefit from the Pfizer vaccine under the chronic illnesses, but again, make sure your condition is stable. Hi, what if we have COVID asymptomatic and go to get the vaccine without a test, please? Well, if you are asymptomatic and you have COVID, unfortunately, you might not know. So then how will you know to get a test? In that case, yes, get your vaccine. It will not harm you because you don't know that you have it. You don't have symptoms. If on the other hand, you suspect you have it, or you are considered as a close contact of somebody who has a confirmed case of COVID, you should quarantine and not get your vaccine until you can leave your quarantine. Is people who did thyroid gland surgery can take vaccine? Oh, can people who have had thyroid gland surgery take the vaccine? Papillary carcinoma 3 years back. Well, if your cancer is in remission, if your health condition is otherwise stable, yes, you should be able to get the vaccine. Okay, so how long does the immunity period last after the second dose? Answered already. If you are allergic to any medication, okay, so with regards to the medication, with regards to allergies in general, if you have had a serious allergic reaction to anything in the past, then you might be excluded for example, the Pfizer vaccine, but you might still get, for example, the AstraZeneca vaccine. Talk to your doctor. It depends on what you had the severe allergic reaction to. It depends, is it part of the content of the vaccine or not? How severe was your reaction before? So again, somebody's asking if you are COVID positive, can you do the vaccine? I've answered that elaborately before. If it is normal to feel anxiety or fatigue after having taken the vaccine. Fatigue, yes, you can feel a bit tired the first few days. Usually it passes quickly. Anxiety, no. If you're suffering from anxiety, please see your healthcare provider. I am using amlodipine for BP and I took my first dose. While taking the second dose, do I need to have my medicine in morning? Blood pressure medication, please continue it. It works only for a short time. So if you don't take your blood pressure medication regularly, you'll have BP fluctuations. Would you recommend hydroxychloroquine instead of being vaccinated with something which we have a lot of doubts with? Okay, so I don't know how to answer this question without laughing. So hydroxychloroquine was something that we started with a year ago. Okay, very quickly it has been discontinued because there was no proof it was working and because it has potential for very serious cardiac side effects. Okay. So no, this is not an option to choose hydroxychloroquine, which has known very serious side effects and doesn't work for COVID-19, to choose that one above the vaccine. Now, the vaccinations, so many trials, millions of people vaccinated, and very limited, usually mild side effects. When we say efficacy of 90%, what happens to the other 10%? No effect or lesser illness effect? So that's a very good question. So we are always hoping that they will still have some sort of immunity, even though it might not be very strong. This is the same for all vaccines that we've all been taking for many decades now. So there is never a 100% guarantee. For example, you take your flu shot. If you take it every year, then not every year will it work 100% for you. Does it mean you will pass away from influenza? Most likely not. So if you do get the virus, most likely you will suffer only mild illness, but no, we cannot guarantee 100%. What has been announced in UAE though, by the COVID task force in UAE is that most of the vaccines have reached almost 100% efficacy when it comes down to the very severe COVID illnesses. That's also good news. COVID positive after first dose, mild symptomatic, home quarantine. How long should we wait? If you finish your home quarantine, if you're doing well, get your second dose. If it is still on time as per the schedule, follow the schedule. Otherwise, as soon as possible. Should we test for COVID? No, I've answered that one already. Okay, sorry, I'm just trying to see. Apparently, I'm on 2 videos. No? um, okay, I will just stop sharing. Okay. Now, are all type of vaccines available in UAE free of charge? Yes, free of charge in UAE and in many countries. Is there a waiting period to get the vaccine if one has had COVID in the last? Okay, again, same question. Is it advised? Sorry, let me just check. So in the meantime, I'm just going to give you a few questions that were sent in earlier on. Now, somebody is asking about travel and if I take a vaccine here, will it be accepted in my home country? For the moment, there is no country that has as an entry requirement listed vaccines. PCR testing for a lot of countries, yes, but there is for the moment no country in the world that says if you're not vaccinated with the vaccine that we want you to be vaccinated and you're not entering my country. There is talk about a vaccination passport that in future you might apply or you might carry a vaccination passport that just demonstrates you've had your vaccines. But there are so many vaccines being used in so many different countries that for sure nobody will be able to say that you cannot take this vaccine or you cannot take that vaccine and then you cannot enter my country. I don't think that something like this will happen. Let's go back to the questions that were sent in. Is it advised to take the vaccine in 2 countries in case we travel to native country? Well, you need, please check that beforehand. If you start with one vaccine here and then you travel and you want to take the second vaccine somewhere else, will you be allowed to get the second vaccine in the country you're traveling to? Will you have access to the same vaccine in the country you're traveling to? So please, this is a very important thing to prepare before you travel. Okay, so let's check. I think we have time for just a couple more questions. Can the vaccine be taken if you have the flu? For most vaccines, if you're having fever, then recover first before you get your vaccine. Again, this is also to make sure that your body will focus fully on the vaccine and will not be distracted by trying to deal with an active influenza at the same time. Is there any? Okay, so again, the timing with regards. So, pregnancy. Is it advised to take vaccine who is taking aspirin and clopidogrel on a daily basis? So, this is about the blood clotting, right? If you take blood thinners, then you might not be a good candidate for certain vaccines. that you can check in your country which vaccine is available in your country and if it is a contraindication. But if you're taking clopidogrel, most of the time it will not be an issue. If you're taking aspirin, it depends on the dosage of the dose of aspirin you're taking. Are these vaccines safe for cardiac-related disease who has stents? So if you have a stent and your situation is currently stable, and you're feeling fine, go for your vaccine. If you've been stented yesterday, you have to wait because you first need to make sure you recover. So if you're taking blood pressure medication, is it necessary to check with GP before taking the vaccine? Very good question. So if you know that your blood pressure is stable, you're feeling fine, and you have no other illnesses, then you don't need to check with your doctor. But if you, for example, just started with your medication, you don't know if it's working yet, you don't know if your blood pressure is under control, then yeah, do check with your doctor. If the person gets the shot and then gets tested positive, does one have to start again with the whole process? If you are able to get your second vaccine still within the time frame recommended, you don't need to start again. As a doctor, which vaccine will you prefer to take apart from your country? Any vaccine that's available. I have no preference. I just want to be protected as much as I can. And I am grateful for any vaccine that I can get and any government that is giving it to me. Okay. I live in UAE. I live in Dubai. The one that was available to me was Sinopharm. So that's the one that I took as soon as I could. But please check in your country which vaccine is available and what is the best one for you. How long are, so that's again asking how long they will work the vaccine. So we don't know yet. How long is Sinopharm vaccine valid? Means how long it works once you, oh, that's again the same, sorry. Sometimes I don't know what question it is until I start to read it. So I think I'll take one last question and then I'll try and take a good one. Are there any arguments against the vaccine? Perhaps lack of comprehensive data, it's still not mandatory, no urgency. If you find an argument in general, not for your particular health condition, but in general, if you find an argument not to vaccinate people and to let this pandemic just continue and let people die, please do tell me. But I prefer that we try to control this pandemic and that we try to limit its spread, the spread of the virus, and we try to limit as many fatalities as we can, as many people who suffer from long COVID as we can. I think with that, I will conclude because I do appreciate this is a difficult decision to take for many people, but consider your health, consider the people around you, and always think that we don't know if COVID will make you seriously ill or not. And so do make a choice that is good for you as well as your loved ones. Thank you very much, everyone. I hope you enjoyed it and have a lovely day.
Thank you very much, Dr. Sarah, and thank you everyone. Thank you very much, everyone who attended the session today. I hope that it has addressed many of your questions. And in case we have not been able to answer any questions, that might be because of the various reasons. Stay safe and stay healthy. Thank you very much.